Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
Have you ever done a deep dive or proper analysis of how your practice makes income or money? Now, I should say this wouldn't really be all that important unless you were interested in making more, money that is, which probably covers 99.9% of the people listening to this podcast. And I have to admit, I have yet to meet a new client or any doctor for that matter whose chief complaint is that they're making too much money. I mean, I've heard I have too many patients, but never have I heard I'm making too much money. Now, if you wanted to do this, you wanted to dig into this, you could look at it could take different forms. You could look at how many of X procedure that you do, or you might find that after you learned or added a new procedure or some new type of marketing that your income increased. You could also dig in to the 3 conditions that affect the ability for your practice to make income, along with how to improve them. The first of these conditions I wanted to focus on in this week's episode. My name is Jeff Bloomberg, and I'm your host. So what are these 3 conditions or things that affect your practice's ability, to make income? Well, let's start simple and then break it all down. They are 1, having something to sell. In other words, a patient who needs treatment. 2, having the ability to sell. And 3, the organizational side of sales itself in your practice. Offhand, this can sound pretty simple. Well, keep in mind, some of the most powerful things are simple. And that said, there is more to this. I've talked about 2, your ability to sell, a lot on the podcast. And if you want to learn how to sell better, I would tell you the best thing you can do in the industry, I'm completely convinced, is the MGE Communication and Sales Seminars. I'll put a link to them on the episode webpage. I've also hit on 3 quite a bit as well, the organizational side of sales itself, through a number of episodes, and I really got into it in episodes 73 and 74 very heavily, the organizational side of sales. But again, you can't sell something if you have no one to sell it to. So for this episode, I wanted to dive into number 1, having something to sell a bit more. And I'm not going to discuss diagnosis. I'm not a doctor or what you're diagnosing, whatever. That's up to you. For this point, I wanted to do a deep dive on where you would find these treatment opportunities in your practice. If you're a GP, we've broken this down to 7 potential sources. Now, what I'm going to do is go through these pretty quick, and then I'm going to break it down further. So what are these 7 sources of potential sales in your practice? All right, so first we have new patients, but we break this down into 3 different types of opportunities. A, new patient initials. Actually, I should say 1. Otherwise, you're going to not wonder if I made 7 or not. Let's say 1, new patient initials. 2, new patient emergencies. And 3, new patient second opinions or consults. All right? Then we have 4 opportunities in your patients of record. Okay? They are recall, just straight up regular recall appointments, 3-month, 4-month, 6-month. 2, patient mid-treatment with the doctor that has more to do. Patient needed 6 crowns. They're only doing 2 now. 3, emergency patients of record. And 4, incomplete treatment that is not scheduled. Like the patient's not scheduled at all. They're on the incomplete treatment list. So we have 3 potential new patient opportunities and 4 patient of record opportunities, making a total of 7. These are your sources for something to sell. Now, what's interesting, if you break this down, if you take a look at this, people tend to fixate on just 1, new patient initials, cleanings and exams. If you look at most of the new the dental marketing that's out there, sure, there's implant funnels, which are kind of a newer thing over the last 5+ years. But for the most part, it's postcards, pay-per-click, dentist near me, come in, get a cleaning and exam, blah, 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 new patient special. The problem I have with this is if your primary fixation for income and for practice survival is on new patients and you're a GP, you've essentially turned your practice into a specialty practice. Like if you're an oral surgeon or an endodontist, you survive off of new patients. As a GP, you have 7 potential sources of income. If you're only living off of new patients, you're basically turning yourself into a specialist. And truthfully, patients of record should comprise 70% of your income. So if you make $200,000 in a month, 140 of that on average should be coming from patients of record. So let's dig into these 7 sources a bit and look at how to improve them so that you can service more new patients as well as more your patient base. So number 1, we have 3 opportunities with new patients. New patient initials, that's obviously handled with your new patient marketing. You're probably doing some type of marketing, whether it's Google pay-per-click or Facebook or postcards or billboards or whatever it might be. And you've already got that. Obviously you can always get more new patients. And if you want to learn how to get more new patients like that, you can always check out the MGE New Patient Workshop. Put a link to it on the episode webpage. The average doctor doing that workshop sees a 40% new patient increase, and it comes with a money-back guarantee. So I'll just throw that out there. But then we have these 2 other new patient opportunities, which are emergencies and second opinions and consults. Now, you may or may not be marketing for these types of opportunities. I would tell you this. This may be an incredible opportunity, or it may be a complete dud, or somewhere in the middle. Like I was just talking to a doctor the other day whose practice did a little bit of emergency marketing, like emergency dentist near me, or so they changed whoever did their Google pay-per-click had an emergency ad in there, an emergency landing page, as well as a second opinion landing page as well. And they saw a huge income increase from that, and it stayed consistent. So for them, it was a great opportunity. If you were doing anything that I mentioned, like if you go, look, I'm going to try this out, I'm not doing it now, and you're already doing well, I would try it out very carefully. Don't blow up what you're already doing if you're doing well. But this is something, if you've never done it before, that you're going to want to approach experimentally. So you can talk to whoever does your pay-per-click marketing or whatever marketing avenue you use and say, hey, I want to do a little bit of marketing for emergency opportunities or second opinions and see what happens. You might find that this is a huge boon to your practice, or it might be, like I said, a dud, or it might be somewhere in the middle. But it might be worth pursuing, and it's one way to check it out. But again, do it experimentally for emergencies as well as second opinions or consults. The nice thing with the second opinion is, in the case of a second opinion, you'll notice in a lot of those cases, they're easier to close, right? Some second opinions are pretty bad. I've heard some bad stories, right? But in many cases, they're easier to close because they're already mid the sales process. You're not starting from zero, right? They've already been told they need 4 crowns, 5 crowns, whatever, or you might find out they need something completely different. But either way, they're already mid the sales process, and they're actively looking, so second opinions can turn out well. So if you could somehow market to bring in second opinions and emergencies, this could turn out well. The key is you want to make sure in your practice that you have the mechanism in place, especially with an emergency or even with a second opinion patient. Once you do, let's say with an emergency patient, the palliative treatment, you want to make sure that they get back on the schedule as a new patient initial. And you should make sure whoever's handling your new patient calls has some exact office policy on how they deal with these things. An emergency, they schedule them with a doctor, it's an exam and a PA, right? For a second opinion, it might be you do a free second opinion. Whatever that might be that you're comfortable with, you should know it, you should be comfortable with it, your office should know it, your manager should obviously know it, and whoever's at the front desk knows it, so that if I call your practice for a second opinion, the person at the front isn't confused about what to do with me. You have an exact thing that you do. Oh, it's a $29 charge for a second opinion because you're taking a PA or something. Or it's free, however you do it, and exactly where you want these on the schedule. So those are our 3 new patient opportunities. It's something to sell, right? We then have the 4 that come from patient of records, right? So record rather. So let's talk about recall for a second. I've talked about your hygiene schedule, your hygiene department. I've talked about that a lot, probably way too much on the podcast, only because in my opinion, again, I'll say it again, the things that are done the worst in the dental industry are 1, case presentation or sales, and 2, recall. It's a completely blown opportunity. Gotten heavy into it in a number of episodes. And if you really want a extended view on this as far as what to do to fix your hygiene department, listen to episodes 45 and 46 called Getting Serious About Your Hygiene Department. The thing I'd mention here, just as an aside, is in a lot of cases you'll see a practice which in theory has the potential with the number of patients that it has for, 12 to 15 days of recall hygiene a week. And keep in mind, I said recall hygiene, not just total hygiene, because you might be seeing scaling and root planings in hygiene, if you have a soft tissue management program or a perio program, and you might be having new patients run through hygiene before you do your exam. So I don't count that in that. I'm talking about straight recall appointments. I've seen practices that should have 12, 14, 15 days of straight recall, and they only have 3 or 4. So you've got this just this plethora of patients in their patient base that are not being brought back in. And this is a huge lost opportunity for the practice because you're spending all this money to bring in new patients, which is usually where there's a lot of focus. And again, not to be disrespectful to the idea of getting new patients, you absolutely should. But I don't know. I'm kind of the mind if you're going to go through all that trouble to get the new patient, you might want to keep said patient, right? You want to retain them. So if you actually put a little bit of attention on retention, which I talk about in those episodes, you might actually see your practice grow a little bit faster. So, and this is what happens. You'll have 20% of your patient base is cool. Not that the other 80% aren't. I mean, 20% are not cool, but 60% are maybe a little bit more difficult to deal with, meaning that they don't keep appointments as well, or but they're good patients, right? So 20% are easy, 60% are on various points of easier or harder or whatever, but they're still good patients. So what happens is your recall department or your hygiene department rather, tends to fill up with these 20%. And these are the patients who will chase you if you have to cancel their appointment, right? So when that happens, and nobody's actively calling the other 60% who are not scheduled, those 60% tend to go inactive. But then those 20% who come in regularly and do everything that you say, when you look at your schedule that day for treatment opportunities or treatment presentation opportunities, there's none, because these are your top tier 20% most compliant patients. They already did what you told them to do. The 60%, who most of them are probably on the incomplete treatment list, no one is calling. So this is how it creates a bit of a situation. Your hygiene department should have 12, 15 days, but it really has 4. Anyway, I got into this very heavily in those episodes, 45 and 46. Check it out. But that's definitely a humongous missed opportunity when it comes to potential treatment. Point number 2 are patients mid-treatment with the doctor. This is a missed opportunity quite often. Now, I want you to be realistic here. Let's say you talked to me yesterday. I needed 6 crowns. I agreed to do 2 because that's what my insurance is going to cover. And I come in tomorrow for you to prep those crowns. Would it be inappropriate for you to ask me about the other 4? I probably would. Like, okay, good, we're going to get started on these 2. Now, look, I would like to do all 6 now. Is there a shot at doing this? And if the patient says, well, I don't know, yeah, I thought about it. How much would it cost again? You might end up doing all 6. Maybe you won't do them today because you don't have time in the schedule, but you're going to do all 6 this year. But that's a huge source of missed treatment opportunities. If you look at your schedule as the doc and you look at the outstanding treatment and what you're not doing, you'll find opportunities in there, some of which are viable and some of which aren't. Where the patient told you yesterday this is all I can do, and they come in the next day and that's still all they can do. But that's fine. No problem in asking if you ask nicely. All right, and then we have emergency patients of record. Again, this is not something that's predictable. I wouldn't necessarily promote for it. Your patient should know that you're available for emergency treatment. Most do. But, I'm curious in a sense if your inactive patients know this. If I had a 4,000 or 5,000 patient base, right, and maybe only 600 or 700 had a next visit, I would wonder how many of those patients that aren't scheduled know that I do emergency treatment. Like, you might want to remind them, like, have a dental emergency, give us a call, so they're not calling the guy down the street, right? And then we get to the 4th opportunity, which is incomplete treatment where the patient is not scheduled. This is the biggie. This is the one I've heard people call it a gold mine. The problem is no one is mining it. So if I have I don't know, I've seen some of these lists that are $2, $3, $4 million in treatment that's been diagnosed that the patient is not doing. And the thing that I've noticed about these lists, number 1, is most of the people on the list are not scheduled at all. Some maybe fall into that category where they're mid-treatment with the doctor and this is just what they're not doing, or they're mid-treatment with the doctor and they haven't done it yet, in which case, fine, right? But the majority of the patients on that list are not scheduled at all. That's the first thing. The second thing is, what does this incomplete treatment list consist of? Like, if you really want to look at it, you could look at it from a number of different viewpoints. Well, patients who couldn't do their treatment now, patients who didn't care about their teeth, really all that list and which I disagree with that statement. Very few people don't care about their teeth. I mean, some don't, but most do. It's mainly people who have not been closed from a sales perspective. If they were closed, they would have done the treatment. So then that brings us to the next thing. If this is my unclosed patient list, how am I going to close them? For that matter, how am I going to close any of these opportunities? The second opinion, the recall patient, etc. I'm going to have to get them in the practice. They're going to have to physically be in front of me. I'm not going to call them on the phone and close them. So that tells us something. So what would we do with this incomplete treatment list? Well, there's a few things you can do. If you have a treatment coordinator, your treatment coordinator should be all over this list. Now, let's take a look at a treatment coordinator's day for a second. So what are they doing most of the time? Well, they're with the doctor doing a treatment presentation or wrapping up financial arrangements with the patient, but that usually isn't what they're doing all day. And if it is, let's say you have so many treatment presentations that your treatment coordinator is literally in an office for most of the day with a patient, then you probably need a second treatment coordinator. I'll explain why. What your treatment coordinator should be doing, if they are not in front of a patient, is they should be working this incomplete treatment list. I mean, before that, they might be doing the more recent follow-ups. Let's say I saw a patient, I don't know, 2 weeks ago with you, and he said, well, I'm closing on a refi for my house, or I'm closing on a house, so I can't spend any money right now, but as soon as I close on the house, I can do this treatment. Well, when are you closing? In 2 weeks. Okay, good. I'm calling them. This is a recent presentation that I'm following up on. So if I'm not with you with a patient or off with a patient doing financial arrangements, I might be doing my follow-ups. Fine. But if I'm not doing any of this follow-ups, what should I be working on? Well, I should have this incomplete treatment list, and I should be calling this incomplete treatment list. Now, what should I be doing? Hey, Jeff, I know that the doctor talked to you about doing these 6 crowns, and you said you couldn't do it right now. Are you ready to do them? You could say that. I don't know that I necessarily would. It would really be circumstantial. What if those crowns were presented 2 years ago? I would probably go instead, hey, Jeff, it's, I'm Jeff, it's Susie from Dr. So-and-so's office. We had you down. We haven't had you in for a cleaning for close to 2 years. We have a year and a half overdue. We need to get you back on the schedule and get your teeth looked at and get your teeth cleaned. Get them back into the office on the hygiene schedule. That's what I would do. Now, you might go, why is my treatment coordinator scheduling hygiene? Well, because they're scheduling somebody with outstanding treatment. This is eventually going to end up, they're kind of going out and getting those opportunities and bringing them to themselves and to you, the doctor, to do this treatment presentation. So if the patient's overdue for a cleaning, they schedule them for a cleaning. If it's been more than 3 years, let's say, or whatever your policy is on when a new initial is required, they schedule them for a new initial. All right, that's what they do if they're overdue. If the patient is not overdue, they were in the office 2 months ago, right? They might call and go, hey, this is Jeff from Dr. So-and-so's office, and the patient go, hey, how you doing? And you might start talking about the treatment a bit, and they may go, oh, yeah, you know what? I'm still going to have to hold off, and that's totally fine. The doctor just wanted me to call you because he or she wanted to see you briefly just to have a look at what's going on and make sure that things are staying stable. All right, so maybe they needed, again, we're using 6 crowns as our example here. Those areas, those teeth, we want to make sure those teeth are staying stable. It's going to be a quick little exam. We just want to get you in for about 20 minutes. So then we get this patient back. The doc looks at them. It gives you another opportunity to present the treatment plan. So if they're overdue, just get them on the hygiene schedule because they'll see the hygienist. The doctor will come in for the exam, and the whole sales process starts again. If they're not overdue, they're not due for their cleaning, get them back directly in to see the doctor to make sure that things are staying stable. Now, if you don't have a treatment coordinator, you could do this as sort of an all-hands action in your practice with your sharper personnel who are more familiar with the patients. You might have a really good assistant, or your schedule coordinator might be good. The office manager could even make a few phone calls, okay? And keep in mind, if you're doing some type of reactivation on these inactive patients as you beef up recall, some of these outstanding treatment patients are going to get caught up in that recall effort, and that's fine. They'll be scheduled to come in on the hygiene schedule. So those are your 7 sources of, quote-unquote, something to sell. So what do you do with this? Well, I have a couple simple things you can do to start. Take a look at the last few months of treatment you've actually sold and started and see where it came from against this list. You can kind of number them 1 through 7. Okay, that was a new patient initial. That was a second opinion. That was an emergency. That was a person off the incomplete treatment list. Whatever, right? Or recall. And take a look at where they're coming from and take a look at how much you're actually producing out of each of these categories, let's say for the last few months. I recommend at least 3 because that's a nice sample size. If you just do last month, you could have an anomaly. 3 months, 4 months, you're going to get a decent sample size. Someone at the front could probably put this together for you relatively easy if you explain this to them. And then you look at this and you go, out of these 7 categories, am I super heavy on one thing, like just new patients, and soft on the rest? Or are we pretty well balanced out, like we're getting people from, more or less every area? And then you could look at any areas where there might be more opportunity, like, gosh, we're getting nothing off of new patient emergencies. There's nothing off of new patient second opinions. There's nobody coming off the incomplete treatment list. Well, then you can, while you're keeping up the things that are working, if things are going well, remember, very important, you could put a little bit of effort in onto these areas that are not doing well, and you might see this create an overall rise in the productivity of the practice. Because ultimately, being on top of these income sources and ensuring that you're not selling out for one and leaving the others to fade away can make all the difference between, an okay and a very successful office. And making sure you're maximizing each area to the best of your ability gets rid of those days where there's no one who needs anything. I don't know if you've ever looked at your schedule and there's just nobody on hygiene who needs anything and your schedule's sort of empty. This makes that a thing of the past. It's a distant memory because you have people coming in from every vector, incomplete treatment, new patients, your recalls beefing up. You're always going to have potential treatment opportunities so that you as the doctor can continue to move your patients to becoming healthier and healthier, and you end up with a more productive practice. Anyway, quicker point where I just focused on one little thing, but I felt it was important enough to focus on it. I do hope this helps. I have those links to the sales and communication seminars and the MGE New Patient Workshop on the episode webpage. If you'd like to find out more about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. Folks, have a great week, and we'll see you at the next episode.